Pattern differentiation in traditional Chinese medicine. Today, we explore the intricacies of diagnosing and differentiating various patterns in TCM, focusing on heat and cold conditions. Pattern differentiation is a crucial aspect of TCM that helps practitioners identify imbalances in the body. By distinguishing between heat and cold patterns, healthcare providers can tailor treatments to restore harmony and promote healing. Excess heat patterns represent a situation where there is an overabundance of yang energy, leading to various physiological and emotional symptoms. Commonly associated symptoms include fever, irritability, and manifestations such as red skin eruptions, acute urticaria, and burning sensations, indicating heat presence in the body. In traditional medicine, it is essential to recognize that fever does not invariably accompany excess heat patterns. This complexity can arise from internal conditions such as interior liver fire and interior heart fire, both of which can manifest without fever, making accurate diagnosis crucial. Interior liver fire is characterized by irritability, anger, and a bitter taste in the mouth. This condition can also present with a red tongue and a wiry pulse, indicating imbalance in the liver's energy. Interior heart fire is marked by symptoms including palpitations, insomnia, and the feeling of heat in the chest. It may also show as a red tongue with a yellow coating and a rapid pulse, reflecting excessive heat in the heart region. Key manifestations of heat. Raised red skin eruptions that feel hot indicate the presence of heat in the body, often signaling an inflammatory response that requires attention. Acute urticaria, commonly known as hives, presents as itchy, raised wells on the skin and is a clear manifestation of heat in the body, often triggered by allergens or stress. Burning sensations, whether felt in the stomach or during urination, are indicative of heat, suggesting possible inflammation or irritation in the affected areas. Hemorrhage of dark red blood is typically associated with heat in the blood, indicating a more severe condition that may require immediate intervention to avoid complications. Extreme restlessness or mania can indicate heat in the heart, manifesting as agitation and emotional disturbances, and is a sign that physiological balance is disrupted. Key causes of excess heat. An increase in yang energy within the body can lead to excess heat condition. This often occurs due to dietary choices, particularly consumption of hot energy foods that stimulate the body. Excess heat can also arise from invasion by exterior pathogenic factors such as wind heat or external infections, which can transform into heat once they enter the body. When external pathogenic factors invade the body, they often convert into heat. This transformation can be triggered by various internal conditions, leading to excessive yang energy and the manifestation of heat-related symptoms. Deficient heat, also known as empty heat, results from insufficient yin energy, which allows yang to become relatively excessive. This imbalance manifests as a range of symptoms that reflect the body's inability to maintain a cool and moist environment. Manifestations of empty heat. Afternoon fever is commonly associated with empty heat, usually presenting as a slight increase in temperature during the late afternoon or early evening. Dry mouth and throat, particularly at night, indicates the body's lack of moisture, commonly experienced by those suffering from empty heat. Night sweating is a significant symptom of empty heat, where individuals will wake up drenched, indicating an imbalance in the body's temperature regulation. Heat sensations can occur in various areas of the body, including the chest, palms, and soles, and can be accompanied by a general feeling of warmth. Empty heat, a critical concept in traditional medicine, emerges from a prolonged deficiency of yin energy. This deficiency results in the relative predominance of yang, creating an imbalance that manifests in various symptoms and health issues. Differentiation between full heat and empty heat. Full heat is characterized by intense symptoms reflecting abundance of yang energy in the body. Individuals typically present with a whole red face, indicating a strong expression of heat. They often have a strong thirst, indicating the heat's effect on the body, accompanied by a high fever that is persistent throughout the day. Empty heat, on the other hand, shows milder symptoms due to the relative deficiency of yin. The face may exhibit mild redness or malar flush, indicating a less severe heat condition. Individuals may have a desire to sip water slowly, reflecting their body's need to balance heat while avoiding overwhelming thirst. Typically, they experience low-grade fever, indicating an underlying deficiency rather than excess. Understanding cold patterns. Cold patterns arise from excess of yin energy in the body, leading to various physiological and emotional symptoms. Common manifestations include chilliness, cold limbs, lack of thirst, indicating deficiency in yang energy necessary for warmth. Patients may also experience dull abdominal pain that worsens with pressure or cold foods, emphasizing the obstructive nature of cold. Understanding pain manifestation from cold. Cold obstructs the flow of qi and blood in the body, resulting in contraction and pain, particularly in the abdominal region. This pain is often characterized by discomfort that worsens with pressure and the ingestion of cold foods or beverages. Indicators of cold in the body. A white tongue coating is a key indicator of cold conditions, reflecting the presence of dampness and the lack of warmth in the body. Concave features, including a concave posture or appearance, suggest a withdrawal of yang energy, often associated with cold conditions. Bluish-purple extremities indicate poor circulation and an excess of cold in the body, often seen in severe cold conditions. Excess cold conditions occur due to an overabundance of yin energy, which can inhibit the body's natural warmth and function. This imbalance often leads to various symptoms, including chilliness and cold limbs, emphasizing the need to address the underlying yin excess for effective treatment. Causes of internal excess cold. When exterior cold invades the body, it can penetrate deep into the internal organs, leading to symptoms associated with cold patterns. This invasion can arise from exposure to cold environments or consumption of cold foods and drinks. Specific organs such as stomach and intestines can be particularly susceptible to cold invasion, leading to digestive issues like abdominal pain, diarrhea, and vomiting. This often manifests as acute symptoms due to the sudden onset of cold. Manifestations of empty cold. Empty cold is characterized by feelings of chilliness and cold limbs, indicating lack of warmth in the body. A dull, pale face often indicates an underlying deficiency in yang energy, a key feature of empty cold conditions. Individuals with empty cold often report an absence of thirst, as their body's yang energy is insufficient to generate desire for fluids. Empty cold is predominantly a consequence of yang deficiency, which leads to inability to warm the body. This imbalance highlights the critical role of yang energy in maintaining bodily warmth and function, and its deficiency contributes to various clinical manifestations, such as chilliness and absence of thirst. Understanding external and internal conditions, cold and heat. Symptoms of exterior cold with pre-existing interior heat include fever with chills, aversion to cold, absence of sweating, headache and stiff neck, body aches, irritability, and thirst. This condition occurs when an external cold invades the body against the backdrop of internal heat. Symptoms of exterior heat with interior cold consist of fever with chills, aversion to cold, sore throat, headache, floating rapid pulse, loose stools, chilliness, and profuse pale urine. This situation arises when the cold condition is attacked by an external heat factor. Heat above and cold below manifestations. A condition where heat rises within the body, often presenting as intense thirst and irritability. This indicates imbalance where the upper body experiences heat while the lower body may be affected by cold. Sore regurgitation and loose stools. This combination can lead to digestive issues, including soured or regurgitated food and loose stools, indicating disharmony between heat in the upper digestive tract and cold in the lower. Indicators of true cold versus false heat. The presence of red cheeks with a pale face indicates false heat in condition, where the cheeks may appear flushed due to a relative imbalance rather than a true heat condition. Irritability accompanied by listlessness suggests a pattern of false heat where the person feels agitated but lacks energy, contrasting with the typical high energy of true heat. Indicators of true heat versus false cold. A dark face with bright eyes indicates the presence of true heat, often associated with excess yang energy in the body. This combination suggests a state of heightened activity or agitation characteristic of heat conditions. A strong thirst with a desire for cold fluids is a hallmark of true heat, indicating that the body is seeking to cool down from an internal state of heat. This symptom reflects the body's response to excess of yang energy. Differentiating full versus empty. Full is also known as excess. Full or excess conditions are characterized by the presence of a pathogenic factor, which can be either interior or exterior. The body's chi remains intact, actively fighting against this pathogenic factor, leading to a wide array of pronounced symptoms such as high fever, irritability, and a strong pulse. Empty conditions indicate deficiency of the body's chi, signifying absence of a pathogenic factor. Symptoms are often subtle, including weakness, fatigue, lack of vitality. If a pathogenic factor persists in the presence of weak chi, it results in a complex condition characterized by both empty and excess conditions. Comparison of empty and full excess conditions. Chronic conditions prevail. Listfulness reflects deficiency. Voice strength indicates energy. Full conditions show excess. Symptoms vary significantly. Accurate diagnosis in traditional medicine hinges on understanding the differences between heat and cold patterns. Recognizing symptoms such as excess yang energy or deficiency of yin is essential to effective treatment and management.
Let's discuss the relationship between different areas of the face and internal organs, exploring how facial regions correlate with internal organ health and diagnostic clues from ancient texts. Each area of the face corresponds to specific internal organs, revealing insights about overall health. Traditional texts, such as the Simple Questions and Spiritual Axis, provide frameworks for understanding these connections, particularly in relation to disorders such as heat diseases. Facial areas and their internal organ correspondences. For the left cheek, a liver connection, the left cheek is linked to the liver's health and can reflect issues such as heat diseases, which may cause the cheek to appear red. Right cheek, the lung connection. The right cheek is associated with the lungs. Areas in this Changes in this area, such as redness, may indicate respiratory issues or heat conditions affecting lung health. For forehead, the heart connection. The forehead corresponds to the heart. Alterations in these area include a flushed appearance can signal heart-related health concerns or heat conditions. The chin, kidney connection. The chin is linked to the kidneys. Changes such as correlation or swelling in this area may reflect kidney-related issues or imbalances. Nose, the spleen connection. The nose corresponds to the spleen. Observations such as redness may indicate spleen health problems, particularly in the context of heat diseases. Indicators of heat diseases on the face. In the heat diseases affecting the liver, the left cheek is the first area to show signs turning red as a reflection of internal distress. The forehead indicates heart heat, becoming notably red as a manifestation of the organ's condition during febrile diseases. In cases of spleen heat, the nose will show redness, signaling potential issues related to nutrient absorption and overall digestive health. Heat diseases affecting the lungs are indicated by redness in the right cheek, suggesting respiratory distress and inflammation. The chin is associated with kidney heat, turning red to indicate potential renal issues, reflecting the body's internal heat dynamics. The five yin organs and their facial correspondences. The liver, it reflects in the cheek. The lungs, it reflects in the right cheek area. The heart, the forehead, is the forehead connection. The kidneys, the chin reflects the health. And the spleen is notable, the nose area. Facial areas and internal organ health in the simple questions. It outlines the correlation between facial regions and the five yin organs, illustrating how specific heat diseases manifest as changes in facial coloration. This ancient text serves as a vital resource for diagnosing internal conditions through observable facial signs. The connections between facial features and internal organs as per spiritual axis. It delves into how specific facial features correspond to the health of internal organs. It underscores the significance of facial structures, such as the bridge of the nose, forehead, and cheeks, as indicators of overall organ vitality and balance. Facial features and longevity. Link shoot insights. The shape and clarity of facial features are linked to health and lifespan. For 100 years, expected lifespan for individuals with well-formed facial features. 10 steps. A clear visibility of facial features from this distance indicates optimal health. The five key facial areas correspond to internal organs influencing overall vitality. 90% of people with balanced facial proportions show better health outcomes. Facial indicators of organ health. The position of the heart can be assessed by examining the xiphoid process, which serves as a reliable indicator of cardiac health and function. The condition of the liver can be gauged through the Appearance of the eyes, as various eye characteristics reflect the health status of this vital organ. Taste preferences can reveal the health of the spleen, as changes in taste are often associated with spleen dysfunction or disorders. The function of the kidneys can be assessed through the ears, as ear characteristics may indicate the overall health of these organs. The condition of the large intestine can be reflected in the structure of the nose bridge, where abnormalities may indicate digestive issues. The case study A. Liver issues indicated by red left cheek. In this case study, the patient presented with a red left cheek, a symptom associated with liver heat, according to traditional texts. Upon further examination, the patient reported symptoms such as irritability and digestive issues, which are common indicators of liver dysfunction. Treatment focused on cooling the liver and clearing heat, resulting in an improved complexion and overall health. While case study B, heart issues indicated by red forehead. This case study, the patient exhibited a red forehead, indicating potential heart heat. The patient experienced palpitations and anxiety, aligning with traditional beliefs regarding heart function. A treatment plan aimed at nourishing the heart and dispelling heat was implemented, leading to significant relief of symptoms and a return to a normal skin tone. The interconnectedness of facial features and internal health. Understanding the relationship between facial areas and internal organs provides valuable insights into health diagnostics. By leveraging traditional knowledge from the text, like the simple questions and spiritual access, practitioners can better assess health conditions and enhance holistic treatment approaches.
Understanding the small intestine divergent channel, an in-depth exploration of the pathways and clinical implications of the small intestine divergent channel in TCM. The small intestine divergent channel is pivotal in TCM, serving as a bridge between the small intestine and the heart. This channel not only facilitates essential physiological interactions, but also plays a significant role in the Zangfu organ system, influencing both emotional and physical health. Anatomy and pathway. The small intestine divergent channel separates from the primary channel at the shoulder, with specific separation points being SI12 or SI10, depending on the traditional view. After separation, the channel descends towards the axilla, continuing its path towards GB22, a crucial acupuncture point in the gallbladder meridian. The channel penetrates the thorax and spreads in the heart, forming a connection vital for the physiological relationship between these two organs. Finally, the channel connects with the small intestine by penetrating the diaphragm, ensuring a functional relationship between the divergent channel and its associated organ. The small intestine divergent channel initiates its pathway at the shoulder, separating from the primary channel at either SI12 or SI10 based on different traditional interpretations. This initial bifurcation is crucial for the channel's subsequent journey towards the heart and abdomen. Pathway details. The journey of the small intestine divergent channel highlights its anatomical connections and clinical significance. The small intestine divergent channel separates from the SI primary channel at the shoulder, specifically at SI12 or SI10, depending on the school of thought. After separation, the channel descends towards the axilla, continuing its pathway toward the heart area. The channel continues its course to GB22, further linking the divergent pathway with the gallbladder area. The channel then penetrates the thorax, establishing a deeper connection within the chest cavity. Within the heart region, the channel spreads and forms significant connections, notably the fourth confluence. Finally, the channel descends to the abdomen where it connects with the small intestine, completing the pathway. Connection to the heart. Understanding the interplay between the heart and the small intestine is crucial in TCM, particularly in diagnosing and treating related conditions. Enhances the relationship between the heart and the small intestine through their divergent pathways. Heart fire dynamics explains how heart fire can transfer to the small intestine and the bladder, creating potential health issues. Acknowledges the importance of this connection in diagnosing patterns of disharmony. Holistic perspective encourages a comprehensive view of treatment strategies that consider both organs' interdependence. Clinical importance strengthens heart-small intestine connection, explains heart fire patterns, essential for health diagnostics, facilitates treatment strategies, supports emotional well-being. The small intestine divergent channel plays a fundamental role in integrating the functions of the heart and small intestine. Its pathway not only illustrates anatomical connections, but also emphasizes clinical relevance in understanding health and disease patterns between these vital organs. History of Chinese tongue diagnosis. During the Ming and Qing dynasties, 1368 to 1911. Today, we explore the evolution and significance of tongue diagnosis in Chinese medicine during the Ming and Qing dynasties, highlighting key texts and contributions. Tongue diagnosis plays a vital role in TCM, offering practitioners a window into the internal health of patients. This practice has evolved through centuries, encompassing significant contributions from the Ming and Qing dynasties, which greatly refined the techniques and understanding of tongue analysis. During the Ming Dynasty, there was a significant development in the field of tongue diagnosis, with numerous texts being published that laid the foundation for future practices. The texts published in this era were largely influenced by Ao's record of the golden mirror of cold-induced disorders, which served as reference for practitioners. Shantu Hian's essential methods of observation of the tongue in cold-induced disorders stands out as a key text from this time, describing 135 distinct types of tongues, enhancing diagnostic practices. Key texts of the Ming Dynasty. We have Shan Tu Yan's influential work, 135 tongue types were described, complete treatises of Zhang Qinghie, and chapter on tongue color differentiation. Impact of epidemics on medical theory. During the Ming and Qing dynasties, there was a significant rise in epidemics of exanthematous diseases such as smallpox, scarlet fever, chickenpox, and measles. These outbreaks prompted a re-evaluation of existing medical theories. These diseases were classified in Chinese medicine as resulting from externally contracted heat, leading to a significant shift away from the traditional focus on cold-induced disorders that had dominated previous medical texts. The high incidence of these heat-related diseases catalyzed a departure from the established views outlined in the discussion of cold-induced disorders, prompting the development of a comprehensive theory for diagnosing and treating externally contracted heat diseases. In TCM, cold-induced disorders were traditionally treated based on the teachings of Zhang Zhongqing, emphasizing the idea that cold conditions required specific prescriptive methods that adhered strictly to established doctrines. This approach focused on the differentiation of diseases associated with cold exposure and the required remedies derived from that framework. On the other hand, heat-induced disorders gained recognition, especially during the Ming and Qing dynasties, where physicians like He Qian argued against the rigid application of cold treatment methods to diseases caused by externally contracted heat. This descent led to a more nuanced understanding that necessitated different diagnostic and treatment strategies, distinct from those applied to cold-induced conditions. Qing Dynasty innovations in tongue diagnosis. During the Qing Dynasty, a significant advancement in tongue diagnosis occurred as a comprehensive and systematic theory was developed. This focused on the differentiation, diagnosis, and treatment of diseases caused by externally contracted heat, reflecting the pressing health challenges of that era. The Qing Dynasty also saw an in-depth study of red tongues, which became a crucial aspect of differentiating diseases related to externally contracted heat. Various types of red tongues were meticulously categorized and analyzed, enhancing understanding and diagnostic practices. Comprehensive works on tongue diagnosis in the Qing period. Significant texts emerged during the Qing Dynasty that advanced the understanding of tongue diagnosis and its application in various disorders. There were 120 illustrations in Zhang Danqian's work of the tongue in cold-induced disorders. There were 8 primary tongue body colors described by Fu Songyan in a collection of tongues. 148 types of tongues were detailed by Liang Te-hyun in Differentiation of Syndromes by Examination of the Tongue. And there was one significant departure from cold-induced focus in Fu Songyan's A Collection of Tongues. 4 levels of disease differentiation introduced by Ye Tianshi in Discussion of Warm Febrile Diseases. Zhang Danqian's work of the tongue in cold-induced disorders played a crucial role in advancing tongue diagnosis during the early Qing Dynasty. His book features 120 detailed illustrations and builds upon the foundations set by Ming Dynasty texts, providing a more comprehensive understanding of tongue appearances in relation to cold disorders. Fu Songyan's work, A Collection of Tongues, represented a significant departure from traditional tongue diagnosis methods by emphasizing the importance of tongue body color over coating color. This text outlines 8 primary tongue body colors: white, pale red, true red, deep red, purple, blue, and black, which are critical for differentiating various health conditions in TCM. In 1906, Liang Te-hyun authored The Differentiation of Syndromes by Examination of the Tongue, showcasing 148 distinct types of tongues. This work played a significant role in advancing the understanding and classification of tongue appearances in relation to various medical conditions. Influential texts by other Ming and Qing physicians. Zhang Qiping, a renowned Ming physician, authored the complete treatises of Zhang Qingyue, which includes a pivotal chapter on tongue color differentiation. This chapter elaborates on how tongue body colors correlate with various disease patterns, enhancing the understanding of tongue diagnosis in TCM. Chen Shiduo wrote The Summit Record of the Stone Room, which contains a chapter titled Experiencing Regarding Tongue Differentiation in Externally Contracted Diseases. In this chapter, Chen discusses how changes in the tongue's coating reflect pathological changes in externally contracted heat diseases, emphasizing the importance of tongue analysis in diagnosis. In 1746, Ye Tianshi published the Discussion of Warm Febrile Diseases, introducing a system of differentiation based on 4 levels of disease. His approach underscored the significance of tongue diagnosis, asserting that all clinical manifestations are reflected on the tongue, which became foundational for diagnosing and treating warm febrile diseases. In 1798, Wu Chu-tong published the Systematic Differentiation of Febrile Diseases. Building upon Ye Tianshi's earlier theories, he introduced the principles of differentiation according to the 3 burners, which enhanced the understanding and application of tongue diagnosis in warm febrile diseases. In his work, Shi Shinon meticulously analyzed the physiological processes of tongue coating formation. He demonstrated how external pathogenic factors directly influence pathological changes in tongue coating, providing a deeper understanding of disease differentiation in TCM. The history of tongue diagnosis during the Ming and Qing dynasties laid the foundation for modern practices in TCM. Innovations in understanding tongue appearance, particularly in relation to disease differentiation, continue to influence contemporary diagnostic methods and treatment strategies. History of pulse diagnosis, an exploration of the evolution and significance of pulse diagnosis in traditional Chinese medicine. Pulse diagnosis has deep historical roots in TCM, originating from texts like the Huang Tinei Su Wen. It emphasizes the significance of pulse examination in understanding health and diagnosing conditions related to the body's internal systems. The Huang Tinei Su Wen is a seminal text in Chinese medicine that details pulse diagnosis, discussing how the pulse is felt at 9 specific locations on the body. These positions are linked to very particular channels, the 5 Zhang organs, and various body areas. The Nanjing, known as the Classic of Difficulties, serves to identify modern pulse diagnosis techniques, emphasizing 3 positions on each wrist and 3 depths. This text outlines the relationship between these positions and the 3 jiao, connecting them to specific organs. Throughout history, the definitions and interpretations of pulse diagnosis have varied, yet there has always been a consensus on the relationship of pulse positions to the 3 jiao, highlighting the enduring significance of these concepts in Chinese medicine. The Wang Tinei Su Wen serves as a cornerstone of Chinese medicine, outlining the methodology of pulse diagnosis. It describes 9 pulse locations that correspond to specific channels and 5 Zhang organs, establishing early foundations for this diagnostic practice. 9 pulse locations and their significance. Understanding the relationship between pulse points, channels, and organs is crucial for accurate diagnosis in TCM. There are 9 pulse locations on the body. 5 Zhang organs are associated. 3 specific channels linked to pulse positions. The Nanjing, or the Classic of Difficulties, is a pivotal text in TCM that elaborates on pulse diagnosis as it is practiced today. It identifies 3 key positions on each wrist, each corresponding to specific depths that reflect the relationship with the 3 jiao in the various organs within the body. Modern pulse diagnosis techniques are rooted in historical practices and have evolved to include a systematic approach involving 3 distinct positions on each wrist. Each position is associated with specific organs and functions within the body. The incorporation of 3 distinct depths during pulse assessment allows practitioners to gather nuanced insights into a person's health status. Each depth corresponds to varying layers of physiological function, enhancing diagnostic accuracy. These modern techniques reflect advancements in understanding the dynamics of the pulse and its connection to overall health, incorporating both traditional knowledge and contemporary medical insights. The 3 positions and their relations. The upper jiao, heart, lungs. Middle jiao, spleen and stomach. Lower jiao includes the kidneys and the bladder. The concept of the 3 jiao is fundamental in TCM, categorizing the body into upper, middle, and lower regions. Each region corresponds to specific organs and physiological functions, integrating pulse diagnosis with overall health assessment. Evolution of pulse diagnosis over centuries. A chronological overview of the key developments and principles in pulse diagnosis from ancient texts to modern practices. Huang Tinei Su Wen. This foundational text details 9 pulse locations related to specific channels and the 5 Zhang organs, establishing the principles of pulse diagnosis in Chinese medicine. Nanjing, the Classic of Difficulties. This text identifies the pulse diagnosis framework used today, highlighting the 3 positions on each wrist and their corresponding depths, linking them to the 3 jiao and specific organs. Modern era, the understanding of pulse diagnosis has evolved, incorporating modern techniques and interpretations, retaining core concepts while adapting to contemporary practices. Pulse diagnosis has its roots in ancient medical texts, notably the Wang Tini Ching Suwen, which outlines 9 pulse locations connected to channels and 5 sound organs. The Nanting, the classic of difficulties, further refined these methods, establishing the 3 positions on each wrist and their relationship to the 3 Tao. Despite evolving interpretations over centuries, a consensus on the foundational principles remains, highlighting the enduring relevance of pulse diagnosis in today's health practices. Theory of meridian systems and scalp acupuncture. Today, we explore the interconnectedness of meridian systems with scalp acupuncture for diagnosis and treatment. The theory of meridian systems reveals the intricate connection between the scalp and the body's meridians, where essential qi and blood ascend to the head. This relationship allows for the diagnosis and treatment of various ailments through scalp acupuncture, reflecting the health of the Zangfu organs and overall well-being. There are 12 primary meridians in TCM, each associated with specific organs and bodily functions, contributing to overall health and vitality. Each meridian is linked to specific organs and bodily systems, playing a crucial role in maintaining balance and harmony within the body. Meridians serve as pathways for the flow of qi and blood throughout the body, ensuring that vital energy reaches all organs and systems. Qi and blood are fundamental components in the theory of meridian systems, closely linked to the scalp and head. Their proper flow through the meridian sustains health, while imbalances can lead to various disorders, making their regulation crucial in treatment. Connection between scalp and meridian. So we discussed the scalp's role in meridians. 12 meridians rise here, connection to Zangfu, diagnosis through scalp observation. The Zang organs, which include the heart, liver, and spleen, are responsible for storing vital substances, such as qi and blood. They play a crucial role in maintaining overall health and balance within the body. The Fu organs, including the gallbladder, stomach, and large intestine, are involved in the digestion and transformation of food. They assist in the movement and expulsion of waste, making them essential for metabolic processes. Scalp acupuncture is based on the theory of meridian systems, where the scalp serves as a crucial interface for qi and blood from the 12 meridians. Specific acupuncture points on the scalp are strategically chosen to treat various Zangfu organs and facilitate the flow of qi, enabling effective diagnosis and treatment of numerous health conditions. Diagnosing diseases through the scalp, utilizing the scalp's connection to meridians for effective diagnosis and treatment. Identifying specific areas on the scalp can reveal insights into overall health. Understanding which meridians are linked to the scalp areas helps pinpoint potential health issues. Evaluating the flow of qi and blood through the scalp assists in diagnosing underlying disorders. Research shows significant positive outcomes for various conditions through scalp acupuncture, highlighting its value in clinical practice. There are 12 main meridians connected to the scalp. 60% of patients with neurological disorders experience symptom relief. 75% of patients report reduced pain after scalp acupuncture treatment. 5 to 10 acupuncture sessions are required for noticeable improvement. The scalp and head are intricately linked to the meridian system, with essential qi and blood from all 12 meridians rising to the head. This connection allows for the diagnosis and treatment of diseases through the scalp, reflecting the health of Zangfu organs and the flow of qi and blood. Anatomy of the auricle, dorsal surface. Today we explore the structural features and acupuncture points on the dorsal surface of the auricle. The auricle or pinna is a key anatomical structure of the ear designed to capture and funnel sound waves into the ear canal. Its complex anatomy, including various regions such as the helix, antihelix, and conchae, contributes to its function in hearing and sound localization. Overview of the dorsal surface anatomy. The dorsal surface of the helix is the curling rim of the auricle located on the lateral side, extending toward the anterior lateral side. It plays an important role in defining the shape of the auricle and contributes to sound localization. The dorsal surface of the helix cauda is the flat area situated between the prominence of the scapha and the earlobe. This transitional zone plays a role in the overall function and aesthetics of the ear. The dorsal surface of the earlobe is a flat area that forms the lower part of the auricle, providing flexibility and aesthetic variation. It is frequently involved in cultural practices like earring placement. The dorsal surface features four distinct grooves that are vital for acupuncture, including the grooves of the antihelix, inferior antihelix, superior antihelix, and helix grooves. Each groove corresponds to specific therapeutic points used in ear acupuncture. The prominent structures on the dorsal surface include the prominence of the scapha, triangular fossa, superior concha, and inferior concha, all of which are essential for understanding ear anatomy and acupuncture points. The dorsal surface of the helix represents the curling rim of the auricle, positioned on its lateral side and extending towards the anterior lateral aspect. Its unique curvature contributes to the auricle's distinctive shape and plays a vital role in collecting sound waves effectively. The dorsal surface of the helix cauda is a flat area located between the prominence of the scapha and the earlobe, functioning as a transitional zone in the auricle's anatomy. This area is essential for understanding the overall structure of the auricle and its role in both hearing and acupuncture practices. The dorsal surface of the earlobe is a flat anatomical feature located at the lower part of the auricle. This area is notable for its flexibility and is often involved in ear piercing and cultural adornments. Ear acupuncture is a therapeutic practice that utilizes specific points on the auricle to promote healing and balance in the body. Understanding the intricate anatomy of the auricle, including its grooves and prominences, is crucial for effective treatment and accurate identification of acupuncture points. The groove of the antihelix is a distinct anatomical feature on the dorsal surface of the antihelix. This groove serves as a crucial landmark for practitioners of ear acupuncture, as it is associated with specific therapeutic points that can aid in addressing various health issues. Groove of the inferior antihelix. The groove of the inferior antihelix is a prominent anatomical feature that extends horizontally across the auricle. It serves as an important reference point for practitioners in ear acupuncture, indicating specific therapeutic areas. The groove of the superior antihelix is an important anatomical structure that runs from the superior medial side to the inferior lateral side of the auricle. This groove merges with the groove of the inferior antihelix, making it a key landmark for practitioners in identifying acupuncture points related to various health conditions. The groove of the helix screws is a distinct depression on the dorsal surface of the helix screws. This anatomical feature is crucial for locating specific acupuncture points and understanding the ear structural layout. The groove of the antitragus is a prominent anatomical feature situated on the dorsal surface of the tubercle of the antitragus. This groove serves as a significant landmark for acupuncture, where specific therapeutic points are targeted for treatment. The prominence of the scapha is situated on the dorsal surface of the scapha and serves as a significant landmark for acupuncture practitioners, often linked to therapeutic interventions. The prominence of the triangular fossa is located on the dorsal surface of the triangular fossa, representing an important point in ear acupuncture practices. The prominence of the superior concha is found on the dorsal surface of the superior concha. The prominence of the inferior concha is located on the dorsal side of the inferior concha and contributes to the overall anatomy of the auricle, serving as a key site for acupuncture treatments. The prominence of the scapha is situated on the dorsal surface of the scapha, a significant anatomical element that contributes to the overall shape of the auricle. This prominence serves as an important reference point in both anatomical studies and ear acupuncture practices. The prominence of the triangular fossa is a distinct anatomical feature located on the dorsal surface of the triangular fossa. It serves as a crucial reference point in ear acupuncture as it corresponds to specific therapeutic points related to various health conditions. The prominence of the superior concha is situated on the dorsal surface of the superior concha, contributing to the curvature and shape of the auricle. This prominence is essential for the auricle's acoustic properties and serves as an important landmark in ear acupuncture. The prominence of the inferior concha is located on the dorsal surface of the inferior concha. The dorsal surface of the auricle consists of distinct anatomical areas, grooves, and prominences that collectively contribute to its complexity. Understanding these structures is essential for both anatomical education and practical applications, particularly in the field of ear acupuncture.
Let's discuss gua sha for hypertension, exploring gua sha techniques and their role in managing hypertension and related symptoms. Hypertension is a condition defined by persistently elevated blood pressure, which can lead to various concerning symptoms, including headache, dizziness, tinnitus, insomnia, palpitations, chest distress, and agitation. Prolonged high blood pressure can cause detrimental changes to critical organs such as the heart, brain, kidneys, and retina, emphasizing the need for effective management strategies. Symptoms associated with hypertension. Hypertension is frequently accompanied by headaches, which can range from mild to severe intensity, impacting daily activities. Dizziness often occurs with high blood pressure, leading to feelings of lightheadedness or unsteadiness, which can be distressing. Tinnitus or ringing in the ears is a common symptom in individuals with hypertension, often adding to the discomfort and stress. Insomnia can be a significant issue for those with high blood pressure, impacting sleep quality and overall health. Palpitations, which are feelings of a rapid or irregular heartbeat, can cause anxiety and often reported by hypertension patients. Chest distress is a common discomfort reported by those with hypertension, often described as tightness or pressure in the chest area. Agitation often accompanies hypertension, manifesting as increased anxiety, nervousness, or distress affecting daily life activities. Pathological changes due to high blood pressure. Long-term high blood pressure can cause significant damage to vital organs, leading to serious health complications. This includes alterations in the structure and function of the heart, brain, kidneys, and retina, ultimately affecting overall health and quality of life. Overview of gua sha therapy. Gua sha therapy is a traditional scraping technique that targets specific areas of the body to improve circulation and alleviate symptoms associated with hypertension. By focusing on the heart, brain, and kidneys, this therapy helps to regulate bodily functions and mitigate the effects of high blood pressure. Mechanism of gua sha in managing hypertension. Gua sha therapy involves scraping the skin to stimulate microcirculation and promote blood flow, which can help alleviate symptoms associated with hypertension. Additionally, it aids in the relaxation of tight muscles and tension, contributing to a reduction in overall stress levels, which is crucial for effectively managing high blood pressure. Importance of addressing underlying causes. High blood pressure is often a symptom of underlying health issues, such as kidney disease or hormonal imbalances. Addressing these root causes is essential for effective management and long-term relief from hypertension. Dietary recommendations for hypertension. High blood pressure patients should carefully monitor their salt consumption to help manage their condition effectively. Limiting salt intake to a maximum of 5 grams per day is advised for healthy adults, while hypertension patients should aim for 3 to 4 grams daily. This reduction can play a significant role in controlling blood pressure levels. Gradually reducing the intake of salty foods is essential. Patients should seek alternatives to high sodium options and incorporate more fresh fruits, vegetables, and whole grains into their diets, improving overall nutrition while managing hypertension. Recommended gua sha procedures. These procedures target key areas to effectively manage hypertension through scraping therapy. The projection area of the heart. Scrape from inside to outside the projection area of the heart on the chest and the corresponding area of the kidneys on the back. The Baihu GV20 and Jianqing GV21. We scrape from the head top to the rear hairline, including GV20, then scrape GV21 point from inside to outside. The Taichu GV14 and related points. Scrape from GV14 to GV1 on the back in sections from top to bottom. Scrape from bladder 13 to bladder 15 on both sides in the same manner. Key points for lower limbs. Scrape LI11 on both sides, GV31, stomach 36, and kidney 3 of lower limbs. Then press and knead kidney 3 on the foot. The technique for scraping the heart area on the chest. We use flat scraping technique to begin at the center of the chest and move outward toward the sides, ensuring you cover the entire projection area of the heart. This method stimulates blood flow and promotes relaxation. Scraping the corresponding heart area on the back. On the back, identify the corresponding area of the heart and apply the surface scraping technique. This helps in further enhancing circulation and relieving tension in the heart region. The Baiqiu GV20 and Jiangqing techniques. The Baiyu GV20 point is located at the top of the head and is known to calm the mind and strengthen overall vitality. Scraping this area can help alleviate stress and improving mental clarity, which is beneficial for those experiencing hypertension-related symptoms like headaches and anxiety. The Jiangqing GV21 point is located on the shoulder and is effective for relieving tension and promoting relaxation. Scraping this area can reduce stress and muscle tightness, contributing to better health function and lower blood pressure. Taishu and related points. Begin the scraping from GV14, which is located at the base of the neck, and move forward to GV1 along the spine. This technique helps to alleviate tension in the back and promotes relaxation of the nervous system. Next, focus on bladder 13 and bladder 15, which are located near the lower back. Scraping these areas promotes improved function of the lungs and heart, respectively, and can help in reducing symptoms associated with hypertension. Key points for lower limbs. LI11, located at elbow, is crucial for regulating blood circulation and can help reduce hypertension when scraped properly. CB31, located on the outer thigh, is effective in alleviating tension and promoting relaxation, which can aid in managing blood pressure. Stomach 36, situated below the kneecap, is known for its ability to boost overall energy and improve circulation, making it beneficial for hypertension. Kidney 3, located near the inner ankle, helps in nourishing the kidneys and calming the spirit, which can support overall blood pressure management. Enhancing gua sha effects with corn stigma tea. Corn stigma tea is an effective herbal remedy that can complement gua sha therapy by addressing heat and dampness in the body, which are often linked to hypertension. By incorporating this tea into daily routines, patients aid in lowering blood pressure and improving overall health. Conclusions and recommendations. Gua sha therapy offers a complementary approach to managing hypertension by improving circulation and relieving tension in critical areas. Alongside dietary modifications, including strict salt intake control and targeting underlying health issues, individuals can achieve better blood pressure management and overall health.